Gender and Social Construct of Illness, Chapter 3, Hierarchies in Healthcare, Patient, Professional, and Gender. I really don't know whether the influx of black and women will change the medical profession in any fundamental way. The way medical education is, I think that sometimes there's a role that they want you to feel, and the pressure of the conform to their role are so strong. There's a whole thing that if you're different, you're oxidized. You feel that you don't know much about much. There have been some changes, but I don't know how widespread they are going to be. Gamble, 1982 258. Hierarchy in healthcare, patient, professional, and gender. Most people think of medicine as a man's profession. However, the majority of the professional healthcare workers in the Western medicine are women. Women have been entering medical school in the United States for the past 30 years. The percentage of women in the medical profession in the United States and Europe, 44% of the medical students in the United States are women, and 23 of all physicians. 49% of the professionally active doctors in Finland are women. 38% Sweden, 35% Denmark, 28% Norway. Men men physicians tend to specialize in glamorous and better paying areas such as brain surgery, heart surgery, plastic surgery, and sports and space medicine. Women physicians are specialties in areas such as primary care, family medicine, pediatrics, obstetric, obstetric, gynecology, dermatology, and ophthalmology. Hierarchies of healthcare providers. In 1999 to 2000, there were more African American women medical students than women medical students than men. 3,188 to 2,000, but more Asian Pacific Island men students than women. 7,128 to 5,580. 8% of the medical students who were African American and the 19% who were Asian as of 1997, only 1% of the full professional were African American and 6% Asian. There are two main parts: healthcare professional, dentistry, and pharmacy. The number of women dentistry in the United States has doubled since 1987, from about 11,000 to more than 22 today, and they or make up the United States or women, but they are 31% of those who are professionally active. A comparison of women and men dentistry in full-time general practice shows that men earns about 26,000 more per year than women dentistry. The percentage of women dental school graduates has ranged from 35 to 38% since 1990. The percentage of women facility in 1997 was 21.8%, of whom 6% were full professors compared to 21% of the men facet. Nursing is the largest women's occupation in the United States with 2 million registered nurses. Most Nurses work in hospitals where they are increasing anatomy, but ultimately taking their orders from physicians. The salary range from 30,000 to 60,000 depending on the region. Nurse, doctor, handmaid, or partner. Florence Nightingale created nursing as a part of medical care during the Crimean War at the end of the 19th century. Nightingale wanted doctors to the cause of professional nursing by making it clear that nurses would be the physician's hand and will only act under doctor's order. She opened a school in Europe for the well-bred gentlewoman and the middle woman who wanted a gentile career. Upgrading and professionalized nursing through a curriculum that combined biomedical science and hygiene and hand-on bedside care. In the mid 20th century, hospitalized patient emotions and social situations were discovered. There are men nursing and physician assistants. In the United States, nursing schools are a place where poor women could get room and board as well as training. The glass escalator is when when men are encouraged by their mentors to move into a position of authority, and it is considered inappropriate for men not to move in up in super. It's a nursing training practitioner is supposed to focus on care, which blurs the distinction between the medical and the sociological and physiological. Unfortunately, social emotional care does not place very high in medical priority. The doctor perspective is the voice of medicine. The patient talks with the voice of life world. These voices represent the technical scientific assumption of medicine and the natural attitude of everyday life. Patients claim that women physicians are more human, more responsive to the social and emotional problems than men physicians. This gender difference does not come from women doctor motherless or greater nursing, but the interactive and situational. As a primary physician treating many aspects of the health problem of long-term patient, physicians tend to encourage patients to participate by asking what they expect and think and by listening to their answers. They talk more to the patient, but more important, allow patient to talk more as well, especially about personal and family issues. It's the verbal communication between men and women physicians also found that women physician nonverbal communication style were more supportive than those of men physicians. The women physician encouraged their women patient narrative with supportive statement and nodding. In contrast, the women physician interact with men patients who were usually older than they were, showed evidence of tension and role strain. Gender congruity is a factor with lesbians who feel they will be stigmatized for their lifestyle seek out women physicians. Even if they are heterosexual lesbian patients feel women doctor will be knowledgeable about their social situation because they have faced the same problem for sexual harassment and discrimination. Women patients are more likely to get good preventative care if they have a woman doctor than a male doctor. The increased focus on women health as a specialized body of knowledge is likely to increase the gap. The women health physician seems to be merging as the specialist without much altering the overall overlook or structure of the Western healthcare. The women health physician serving as an advocate for women health needs as well as expert and feminist promoter of medical knowledge and knowledge on women health. Can women doctors change healthcare? How much of an impact has the recent influx of women doctor had on medicine as a whole? Has this present made a difference, or have they assimilated the standard biomedical bias and perspective? These are questions have been raised as Western medicine seems to be going female in the United States as well as in other countries. The status and influence of women doctors is dependent on the organization and finance of the health. It says, what do women physicians bring to healthcare that is different? They have a history of attention to the physical, social need of patient. White women doctors set up their own infirmary when they were denied access to the disciplinary dispensary and clinic that gave Novocaine. The women doctor infirmaries were run for mostly women and children patients and offer free and low cost care. The women clinic, which completely staffed by women, included a black woman doctor surviving the rise of the Origin equipped University Hospital, which it says in 1921 the Shepherd Tower Act set up state and federal funds maternal and child health centers throughout the country. In 1960, Medicare and Medicaid increased the number of patients, therefore allowing the doors of the U.S. medical school and hospital open to women. In 1970, the U.S. the feminist high health movement established client run for women patients that stress education and health matters, self-examination, and altered medication. By 1990, most of the feminist movement general clinic has has been abandoned. In 1997, a workshop was held calling for participatory research based on women experience both of the physiological and their sociological home and work environment.